Welcome to October, National Physical Therapy Month. Thank you for joining us. I'm Dr. Moss with Moss Rehabilitation Center. I've been a physical therapist for over 27 years. In this video, we're going to talk just slightly about the history of physical therapy and also what physical therapy can do for you. Physical therapy was started in the 19th century. Which is several years ago. And then fast forward into the early 1921s or so, during World War I and II, physical therapy became a lot more kind of embraced and popular because it was crucial to help rehab a lot of the wounded soldiers. And that's something we still continue to do to this day. Physical therapists are found in a variety of settings, whether it's an outpatient center like the one we have here in Springtown. It could be hospital-based settings. They can even come into your home. And so physical therapists and physical therapist assistants, they work closely with the rest of the medical teams, the physicians, the nurses, nurse practitioners, physician assistants, to help create a holistic healing environment for you. So as you come into the physical therapy world, our job is to help get you more mobile, stronger, help keep you independent and functioning so you can avoid harmful surgeries, medications, or recover from potential surgeries and or other injuries. They're seen in the athletic training world. They're seen on professional teams, amateur teams, and what I just like to call the weekend warriors. So most of our patients are weekend warriors. They're coming in, they've injured themselves doing something at the house, whether it's playing with a kid or a grandkid, it's lifting feed sacks, hay bales, the groceries. It doesn't really matter. Physical therapy can treat a variety of issues, whether it's neck pain, headaches, shoulder pain, surgical, non-surgical, knee replacements, knee pain, low back pain, ankle foot sprains, ankles, return to sport. There's a lot of different avenues that a physical therapist can touch on and help you recover. Part of the field that is so amazing is that we can work in so many different settings and we can see such a large variety of patients. We can also help with some chronic pain management. Frequently, patients that come into our clinic, they've seen pain physicians, maybe they've had injections, maybe they've had surgery, and they're in a lot of pain. And so we'll focus in on that musculoskeletal portion of it, helping to relieve some of the tightness and stiffness in the muscles and the joints and help strengthen those areas that are also weak. We can also work on injury prevention. So for us, we run through the 5 phases of healing, and phases 4 and 5 focus on maintenance and injury prevention, as well as performance enhancement. So whether you're trying to get back onto the field or just the field of life, we're here to help you. Mobility and independence. As we age over 65, 1 in 4 adults will typically take a fall. Some of those can be fatal. And so working on your overall mobility, your strength, your balance, and your independence is something that a physical therapist is definitely designed to help you do. We see a lot of patients that come into the clinic, they've got balance and mobility issues. They have trouble walking in the grocery store without hanging on or leaning onto the cart, whether it's because of low back pain or balance. And those are things that we help them improve on so that they can continue to live a functional and independent life, enjoying time with friends and family. And then, as I mentioned earlier, just holistically, we're frequently in touch with the physicians' offices, the nurses, the PAs. We work collaboratively with other team members to make sure you're getting the best experience and the best rehab possible. One of the things that we see and hear a lot of times is, well, as low back pain, for an example, well, should I get an injection or should I do therapy? And I say yes, because the injection works on something different in terms of reducing the pain and inflammation locally at that site. They're putting a needle all the way into the back. We can't do that. And so we're working on a different component of it. So I see it as a collaborative approach and not either or. And frequently the patients that if they do need some type of injection, that it works best as they're undergoing their physical therapy and not treating them as separate, distinct procedures, which is what happens a lot of times. So all in all, October is National Physical Therapy Month. If you know a physical therapist, if you've been to a physical therapist, we're here to help you guys. But please, if you're currently in therapy or you just go by the office, stop in, say hi, National Physical Therapy Month. Appreciate what you guys do. I certainly appreciate being able to do this for 27 plus years, helping thousands of patients with various conditions. It's an absolute joy. I love the profession. I think it's an amazing field for young people to get into, and I think it really helps keep you independent, mobile, and strong well into those upper 80s, 90s, and possibly into the hundreds. So happy Physical Therapy Month. Hope you've enjoyed this little segue about PT, and have a great day.